I guess the first question is, can we be addicted to food truly? And what does that look like? And what are some steps that people can actually take if they believe they have a food addiction?
Yeah, thank you. I'd like to say that I've spent a lot of time exploring the literature, contributing to the topic of food addiction, and mostly trying to put it in the context of eating disorders, which will, consider the role of dietary restraint, diet culture, weight stigma, and putting it into this social context, right? So again, one could look at food addiction as a neurobiological process where the reward pathways are overactivated in the brain, and we're seeing a clear, consistent body of evidence to support that. But then again, needing to put it in the social context of what neighborhoods do people live in, the family that people live in, the access to resources, et cetera. So I think one of the discernments that needs to be made in the food addiction conversation is that there is an important need to discern between food and ultra processed food. I think one of the arguments against food addiction is that, food in its natural state, the almond, the plum, don't seem to lead to addictive like processes, but it's very clear that highly palatable, ultra processed food with added ingredients is sufficient to produce neurochemical changes that quote unquote hijack the brain in susceptible individuals, right? So this is where the conversation around trauma comes back in. If someone had a lot of early life adversity, they were exposed to trauma that changed their biology, that made them more susceptible to reward-based processes, that person might be more susceptible to addiction like eating. One of the disservices in the food addiction conversation has been equating it to cocaine and heroin. And I think they had some animal models that show sugar is more addictive than cocaine. And I think that didn't help the conversation around food addiction. What I think is much more helpful is to look at it more like addictions to caffeine or nicotine, right? So if we were to take the caffeine example, if someone were to say, well, is coffee addictive, right? You'd get a lot of people that would say, I really like my coffee. I enjoy it. I like the taste. I really had 1 cup in the morning, but I'm not addicted, right? And then you would get other people that would say, without a doubt, like, I am not okay without my cup of coffee, right? And then there's other people that need coffee throughout the entire day. There's some people that when they don't get it, they get a headache. And if someone else doesn't get it, they might be thinking about it a little more than would feel normal or healthy. But if you were to take the caffeine example and think about like, okay, can food be addictive, right? Let's do, can caffeine be addictive, right? And it would probably be difficult to make the argument that people were addicted to green tea, right? It has a low dose of caffeine in it. There's probably some people that drink a lot of green tea throughout the day and need it. But once you start increasing the dose of caffeine and you go to coffee, it's a little bit more potent. And then you get these major corporations that are adding a little bit of caffeine, making the coffee a little bit more quote unquote addictive. Anyone knows that like the Starbucks and the Coffee Beans of the world have coffee that's a little bit more rewarding than you might be able to make at home. At least that's been, my experience. But then, if you were to take it one step further and start looking at energy drinks, right? You get these other products that have 300 plus milligrams of caffeine with some other things in them, right? So you get people, and this is something we see often in early addiction recovery, that might drink 4 energy drinks in a day, right? And so, is caffeine addictive? For most people, you would say no. Arguable. I think I would probably say yes. It really depends on how you operationalize and define addiction. Dependency perhaps is a better word. But there's a small subset of people that have a real caffeine use disorder, right? And they are not okay without high doses of caffeine, and it's a real problem. And if you were to look at food in a similar fashion, right, you would say that, most people might not have addictive processes around food. When there is early life trauma, when there is a lot of stress, other forms of adversity in adulthood, if people live in neighborhoods that have very limited access to higher quality food and they just overexpose themselves, we're starting to see a little bit more of what would appear to be like a food addiction. And then there's people that have severe actual food addiction, right? Who have relationships to food that cause significant impairment and distress, right? And so I think to say, there's people, and this comes a lot from dietitians, right? Screaming on the rooftop, food addiction doesn't exist. It doesn't exist. I find that to be, very tunnel-minded. People really want to see the world through the lens of their own experience. And so my answer is absolutely, ultra-processed food addiction does exist. It exists for a small subset of the population, the same way alcohol and drug addiction exist, but it shows up in a higher percentage of the population. The most recent systematic review meta-analysis reported a prevalence of food addiction around 20% worldwide, which is a little bit higher than drug and alcohol. I think alcohol and drugs is somewhere in the 10 to 15, probably getting higher these days with some of the drug crises that are out there. But the food addiction prevalence is much higher in clinical populations, particularly those that have eating disorders. And this is where the conversation gets really polarizing and people have a lot of differing views, is that, when someone has bulimia nervosa or binge eating disorder, and then they have really severe food addiction symptoms, can you separate the signal from the noise? Can you say that it's an actual food addiction, or is the food addiction symptoms a relic of the eating disorder symptoms? So that's where it gets really confusing. If someone's been on a diet for a major portion of their life and they have internalized weight stigma, they have a lot of conflict around the body that they live in, and they're constantly trying to diet, they might end up with higher food addiction symptoms than the average person because of their dieting behavior. So that's where I think the future of food addiction needs to be, is being able to disentangle the actual food addiction signal from some of these other factors that make it a little bit less clear. And I think once we're able to do that, we can get some progress on potential solutions. But in terms of solutions, I do work clinically with people, and I've had a lot of success with eating disorder treatment and even considering the role of addiction like eating. But I really believe that the food addiction conversation needs to have public health and policy implications. I think that to expect people to be able to recover with abstinence-based models is somewhat unrealistic. There's a very small subset of the population that do that. I usually don't endorse that approach. There are cases when that's the only approach. But to think about ultra-processed food addiction as something that brings food companies to the table and starts to have conversations around how we can improve the national and international food environment in conjunction with trauma-informed care, right? Helping people's nervous systems, reducing exposure to highly palatable food, promoting better health equity, getting people better access to foods. I think that angle from a public health standpoint will be way more fruitful than saying, okay, here's the clinical implication of food addiction. That being said, people that have severe ultra-processed food addiction can find pathways to recovery, and it's going to differ from person to person. Some people might identify specific foods that are quote unquote triggering, other people specific ingredients. But if anyone's going to do a very targeted type of nutrition intervention, it's very important that they stay well-fed, well-nourished, eat foods from all the different food group categories. And there's substitutes now for people that don't eat from all categories, but get foods that are also, salty, crunchy, smooth, cold, hot, and to satisfy the dopamine pathways in the brain enough so they aren't sort of walking on eggshells. The biggest criticism of food addiction recovery is that people try to go on an extreme diet, and it seems to be just a matter of time before they get exposed to a food, and then they're binging again, and then the problem oftentimes gets worse. So there's an important need to look at food addiction, not just at the individual level and separate that from classic eating disorder symptoms, but also to look at it at the community, neighborhood, and larger ecological context.